Constipation refers to a condition in which a person experiences difficulty in passing stool, and bowel movements are infrequent or challenging. It is characterized by infrequent bowel movements. Bowel movements occur less frequently than usual. While the normal frequency can vary from person to person, typically, having fewer than 3 bowel movements per week might be considered constipation. Difficulty passing stool. When a person with constipation tries to have a bowel movement, they might experience straining, pain, or discomfort. The stool can be hard, dry, and difficult to pass. Feeling of incomplete evacuation. Even after passing stool, a person with constipation might feel that their bowel isn't completely emptied. Abdominal discomfort. Constipation can cause abdominal bloating, cramps, and general discomfort. Other symptoms. Some individuals might experience symptoms like reduced appetite, a sense of fullness, and even mild nausea. Several factors can contribute to constipation, including diet. A lack of dietary fiber, not drinking enough fluids, and excessive consumption of processed foods can contribute to constipation. Lifestyle. Sedentary habits and lack of physical activity can slow down bowel movements. Medications. Certain medications, especially pain relievers, antacids with aluminum, and some antidepressants, can cause constipation as a side effect. Medical conditions. Certain medical conditions like hypothyroidism, irritable bowel syndrome, IBS, and neurological disorders can lead to constipation. Ignoring the urge. Ignoring the urge to have a bowel movement can lead to constipation. Age. Constipation can be more common in older adults due to changes in muscle tone and activity in the colon. Mild cases of constipation can often be managed with dietary changes, increased water intake, and regular physical activity. Including fiber-rich foods like whole grains, fruits, and vegetables in the diet can help soften stools and promote regular bowel movements. In more severe or persistent cases, medical intervention might be necessary, which can involve the use of laxatives or other medications, depending on the underlying cause. The signs and symptoms of constipation can vary from person to person and can range from mild discomfort to more severe issues. Here are some common signs and symptoms associated with constipation. Infrequent bowel movements. One of the primary signs of constipation is having fewer bowel movements than usual. Some people might have bowel movements only a few times a week. Difficulty passing stool. Straining during bowel movements is a classic symptom. The stool may be hard, dry, and lumpy, making it difficult to pass. Abdominal discomfort. People with constipation often experience abdominal bloating, cramps, and general discomfort in the stomach area. Feeling of incomplete evacuation. After having a bowel movement, some individuals might still feel like their bowel isn't completely emptied, leading to a persistent sensation of needing to go. Hard stools. Stools might appear hard, dry, and difficult to pass. They can vary in color, but they often have a more compact and dense appearance than normal stools. Straining. Frequent straining during bowel movements is a clear indication of constipation. This straining can sometimes lead to hemorrhoids or anal fissures. Small stool size. Stools might be smaller than usual, reflecting the difficulty in passing them. Changes in bowel habits. A noticeable change in the regular pattern of bowel movements can be a sign of constipation, especially if there's a sudden shift from regularity to infrequent or difficult movements. Excessive gas. Constipation can lead to the buildup of gas in the intestines, resulting in increased flatulence. Discomfort in rectal area. Some individuals might experience discomfort or pain in the rectal area, often related to the buildup of stool. Loss of appetite. In some cases, constipation can lead to a reduced appetite and a feeling of fullness. Nausea. Severe constipation can sometimes lead to feelings of nausea and discomfort. It's important to note that while occasional constipation is common and often related to dietary or lifestyle factors, chronic or severe constipation might be indicative of an underlying medical condition. If you experience persistent or worsening constipation, or if you notice additional symptoms like blood in the stool, unexplained weight loss, or severe abdominal pain, it's advisable to seek medical attention. A healthcare professional can help diagnose the cause of the constipation and recommend appropriate treatment options.